a looming mental health crisis. It's a silent pandemic, and it's something a lot of people should be paying attention to. And that's what we want to do. We want to highlight this topic, and we hope that it will be useful to all of you. So Marta Ramos, as has been mentioned, is a psychotherapist, mental health behavioral specialist. And she's done a lot of work in the Lehigh Valley area in Pennsylvania. And I'm delighted to have her here and to share with us. So Marta, please take it away.
Good morning, everyone. Buenos dias. Thank you so much for the opportunity and for you guys to be able to join us this morning. I'm delighted to be able to present this topic. It's very close to my heart in so many different dimensions. So the whole purpose is, first of all, to be able to bring awareness of something that I believe hasn't been tackled, and I believe that the whole entire community is fully aware. It's interesting that the structure or the system has been focusing on bringing a solution to this pandemic, and we're talking about the vaccination, but we haven't been able to address other specifics that have been targeted affecting the community, which is the mental health component. So I was able to talk to Eli about this and say, you know what, we need to address this, and especially because there was a huge social disconnection within communities. People were able to just social distance themselves purposely, just following the CDC regulations, which is strongly encouraged to everyone. But at the same time, it's time to be able to bring back to the community, not only in a collective basis, but also individually, to be able to address the mental health component. So with that being said, we're going to give you a brief presentation. And after that, we can be able to just answer any questions or any concerns that you may have. Okay. So when we're talking about addressing the silent pandemic, a looming mental health crisis, so the whole focus of this particular presentation is, first of all, identify the impact of current pandemic crisis within communities of color by targeting mental health issues. And please, the mental health affects every single one of us. Humanity itself was affected by this pandemic. The whole idea of just targeting the color community is because we want to help our population to break the stigma of mental health specifically. So everyone should be addressing the mental health component, especially all the things that we have been going through for almost 2 years. So the second objective that I would like to basically just work with you guys is addressing the stigmatization of mental health management with identified communities. Then the other one is exploring practical ways to decondition from mental health stigmatization. And last but not least, and this is one of the most important objectives, is to review self-awareness practices towards improvement of mental health stability. So our responsibility, first of all, is to identify and define what is mental health, okay? So according to NAMI, which is a National Alliance of Mental Illness, it recognizes that other organizations have drawn distinctions between what diagnoses are considered mental health conditions as opposed to mental health illnesses. The Alliance intentionally uses the terms mental health conditions and mental illnesses interchangeably. The reason that they are doing this specifically at this point is just to start breaking the stigmatization. There are a lot of individuals when they're called patients, they automatically assume that they're going to be treated differently. And, compared with treating them like clients, they believe that they're going to be served accordingly. And this is basically according to the service that we have been provided, the clinicians and human services specifically, including caseworkers, people that work directly with people and addressing mental health issues. So let's define what is a mental illness. A mental illness is a condition that affects a person's thinking, feeling, behavior, or mood. These conditions deeply impact day-to-day living and may also affect the ability to relate to others. Mental health conditions are far more common than we think, mainly because people don't like to or are scared to talk about them. And this is related to the stigma that we have been talking about. In our culture specifically, and I'm going to talk on behalf of the Hispanics and, being raised as a Puerto Rican, born and raised as a Puerto Rican, when we talked about the mental health specifically, those are things that we don't talk about. We address them at home. We don't go to a place, and especially the statement that if you go to a psychotherapist, a psychologist, or a psychiatrist, that means that you are crazy. And this is what we're trying to be able to break at this point in history. There's nothing wrong about addressing this with a professional, especially under the circumstances that we are. We're trying to be able to encourage you to detach from isolation and start speaking up about what is really going on. How are you handling this crisis? What happens when you are at home and no one listens? What happens when you are at work and you are overstressed? You're overwhelmed about what is happening in your surroundings because you are supposed to continuously serve others. However, 1 in 5 United States adults experience mental illness each year. 1 in 20 United States adults experience serious mental illness each year. 1 in 6 United States youth from the age of 6 to 17 experience a mental health disorder each year. And 50% of all lifetime mental illness begins by age 14 and 75 by age, and I apologize, I cannot see the,
Sorry.
It's okay, by age 24. So there are a lot of things that unfortunately they haven't been addressed in public, and I am willing to talk about this openly. Within this pandemic, there is a severe increase of domestic violence. Also, there is a severe increase of co-occurring disorders. Alcoholism has been skyrocketing in a very significant way. Drug addiction as well. And the co-occurrency concept is basically the combination of both the mental health and substance use disorder. So these are the things that, unfortunately, the structure it hasn't been able to talk about it in detail because the focus at this point is to provide the vaccination and then to tackle the other issues that came from the pandemic. So this particular image that I'm sharing with you, during late June, and this is 2020, 40% of the United States adults reported struggling with mental health or substance use. So as you can see, the anxiety and depressive symptoms, and we're not talking about anxiety and depression diagnosis, we're talking about symptoms itself, is the 31%. Trauma, stressor related disorder symptoms, and we're talking about vicarious trauma. And this is a subject that eventually we can bring up in a different webinar. So how can we be able to address vicarious trauma? And especially because it's a very sensitive subject, it's going to take a little bit more time, but this is the introduction in order for us to be able to tackle this particular element. Started or increased substance use, and again, this is June 2020. So we believe that has been a significant increase in regards of the current disorders, and seriously considers suicide. It's 11% compared to what happened before pandemic. And there are a lot of suicidal episodes that they were never reported on the system because there were family members that they were able to create interventions and just like, we're going to deal with it. Don't worry about it, but they never called anyone to be able to address it. And most of this particular situations are documented according to, the mental health institutions specifically, and crisis line as well. Now, a mental health condition isn't the result of one event. Research suggests multiple linking causes. It could be related to genetics, environment, and lifestyle influences, whether someone develops a mental health condition, a stressful job, or a home life makes some people more susceptible, as the traumatic life events like a biochemical process and circuits with brain structure may play a role in this too. So in this case, what we're talking about is the pandemic specifically, and this is the hush-hush conversation. There are a lot of people that develop resilience throughout the process, meaning that they were able to survive throughout the pandemic. But the issue is that this triggers trauma. And unfortunately, we don't have enough resources to be able to just address how this pandemic caused trauma throughout the whole entire humanity. None of this means that individuals are broken or their past generations is something wrong. Mental illness is no one's fault. And for many of the people, recovery, including meaningful roles in social life, school, and work, is possible especially when you start treatment early, and play a strong role in your own recovery process. So this particular statement shares with us that it starts with us first. And we're going to be able to just talk about it at the end of this particular webinar. There's a particular chart that I'm going to share with you. And I'm going to ask you a couple of questions. They're rhetorical, but it's for you to just start working on yourself and consider, is this something that I need to address as soon as possible? Now, in this particular image, and this is a key component, and please, again, as I mentioned, this is not necessarily in regards of this particular population. We need to take in consideration the Caucasian population as well, since everyone has been affected. But this is the particular target that we're going to be able to address today. And we're more than welcome to create another webinar to be able to talk about the whole entire population. So how COVID impacts people of color. During the COVID-19 pandemic, the Crisis Text Line, a nonprofit that provides free peer counseling via text to those experiencing a mental health crisis, has seen a dramatic spike in users. Here's a look at exactly how COVID-19 is impacting specifically people of different races, particularly for the Latino community. Okay, so 14% of African Americans texters mention a recent loss of a loved one, which is almost twice as high as the average texter, which is 8%. So I have in the corner of this image is the crisis text number purposely placed because sometimes we don't have anyone to talk to, and we're embarrassed to be able to address what is happening. And the number is basically free of cost. Please just, if you need it, just reach out. I will also encourage you to do research about the crisis number. There's a national crisis number, it's an 800 number. Please, please, please just take advantage of these resources. They're excellent. The people that are serving are professionals. They're willing to be able to continue to provide not only an extension of welfare, but to be able to extend safety to your lives. Now, 20% of Asian texters mentioned having recent experience of racism and or discrimination more than 3 times the average texter. And why is this? As you know, when the pandemic started, and social media was very influential about this, they were mentioning that this particular illness started in the basically Asia. We were talking about, or the system was talking about, probably China was the one who developed this. There were a lot of conspiracy theories about it. So therefore, people, when they wanted to just go out and just have a life, they just felt that rejection and they didn't have anyone to talk about it. So this was the way for them to express that they felt discriminated because of what was basically told about their culture and the influence within the pandemic. Now, 46% of the Hispanic population that were able to use this crisis text number were able to identify that they were going through financial issues. And there's something that we need to take in consideration too. There were a lot of families throughout the whole entire nation that they needed to make some adjustments in their time management to be able to stay at home, to be able to serve their children because school became cyber. There were a lot of difficulties for people to adjust throughout the pandemic, and still is reflected. We're talking about just going back to norm, but unfortunately, in order for us to be able to do that, if it's possible, is to be able to address the trauma of all the adjustments that the whole entire nation was able to go and develop resiliency throughout this whole process. Now, let's talk about the mental health stigma. Mental health stigma can be divided in 2 distinctive types. Social stigma, which is characterized by prejudicial attitudes and discriminating behavior directed towards individuals with mental health problems as a result of the psychiatric label they have been given. And unfortunately, we have a tendency, and this is very sad, that whenever someone is assigned a mental health diagnosis, it becomes a label. And I'm going to use a simple example. This one is experiencing mood swings. This is a bipolar episode. It's very biased. It basically increases the stigmatization, and we need to create more sensitivity towards this particular diagnosis. In contrast, perceived stigma or self-stigma is internalizing by the mental health sufferer after perceptions of discrimination. And this is coming from Lincoln, Scrutiny, and Shroud in 1989. And perceived stigma can significantly affect feelings of shame and lead to poor treatment outcomes, coming from Perlich, Rosencheck, Clark King, Siri in 2001. So let's talk about the stigmatization's catalyst. What basically may trigger this? So difficulties accessing healthcare coverage. And unfortunately, and I'm gonna be honest with you, and I can give you a self-disclosure. When I came to the United States, it was encouraged to me to be able to automatically just apply for welfare assistance and to be able to support not only myself, but my daughter at the time. And to be able to go through the process, it was extremely difficult because not only you're trying to access information that is given to you, but you just go through different types of routes. And at the end, it's very difficult. There are a lot of people that have difficulties as a language barrier to be able to access these benefits. So of course, this is what we were talking about, the internal stigmatization. You know, what am I doing wrong that I cannot be able to receive the proper help? And therefore, I don't deserve to basically talk about my problems because no one is willing to listen. Another one of the catalysts is low income, lack of knowledge about services available, and this is critical. We need to foster within our communities a way that either creating little cells that we can provide information to our communities in a confidential way, not only on the system, basically just accessing the internet or the computer. There are a lot of family members, they don't have access to electronic devices. So what can we do as a community to be able to provide this information for services that they can have access to be able to start taking care of themselves? Of course, a language barrier, and this is significant too. I know that the system provides different types of languages or access to people that have difficulties with language, but still it is difficult for people to comprehend, understand what they need to do in order for them to acquire benefits and to be able to take care of themselves. Fear of agencies and entities. And I'm going to set an example. As a professional, I heard so many times, you know what, if I tell what is going on at my household, and especially because I have children, I believe that the system will take them away. I believe that they will basically place me in a hospital scenario, and I can basically be locked down for the rest of my life. This is part of the stigmatization, and we need to teach our communities that the whole purpose of the structure or the system is to be able to extend support, to extend safety, and to be able to provide better welfare. Labeling associated with the mental health and substance abuse, and this is typical too. For people that struggle with substance abuse dependency, they're calling the whole concept of they're drug addicts. That is basically a label. It's a bias, it affects the community, and it doesn't allow them to just break from the stigmatization that I can be able to just go and seek for help without being judged or condemned because of my current condition. Another one is influences of cultural and religious beliefs, and especially in our community. It's unfortunate at this point in history that still the system believes that because I believe in this particular religious affiliation, I shouldn't be looking for mental health assistance. So we need to basically encourage this particular communities to just create integration, to be able to provide safety and then just tackle in a holistic way, you know, not only the body, the soul, and the spirit at the same time in order to be able to create the stability and safety. And last but not least, the ethnic and racial prejudice, and especially because all the divisions that has been happening throughout history itself. Now, how do we decondition from mental health stigmatization? Well, this is the basic component. We need to start developing a safe and conducive environment to address mental health concerns. How do we do that? Let's get together as a community and we can still follow the CDC regulations. I understand social distancing is a key component. We're going to respect the authorities. That will never change. I am basically bound to do that as a professional. Yet, I need to encourage the communities to be able to just come up together with a plan and just talk about, okay, so how can we provide a structure that people can be able to talk about their issues and we can extend services or at least just refer them to a particular service that can be able to benefit them. Explore the needs of individuals and communities regarding personal and collective stigmatization. It will be incredible to just be able to develop within communities, particular groups or small groups that people can be able to talk about. Okay, so how do you deal with the concept of stigmatization? How do you feel about just living on this particular community and feeling that you don't have a voice, that you cannot be able to express what you're going through because of the fear of being stigmatized or prejudice itself, or not being able to receive the proper assistance that you deserve. Also, we need to consider cultural sensitivity, and that applies to every single type of ethnicity in this particular nation or worldwide. We are not different from each of us. We do have differences, but ethnicity shouldn't be that particular target or that particular aspect that creates division within community. On the contrary, it should be that particular element that fuses the community, because we need each other at this point, especially to address trauma. Also, we need to address difficulties to communicate assertively, especially about our emotions, conditions, and behavioral patterns related to stigmatization. So let's talk about how our own history, especially, how we were raised, our culture, we need to talk about how this has been influencing us in a way that we can start breaking the stigmatization. And last but not least, create connections within community to address concerns about mental health stigma. Okay, so now, last but not least, I'm gonna just present a little exercise to every single one of you. This is for you guys to just take it home. And I want you to consider and just ask these particular questions within that chart that is presented in this presentation specifically, and I apologize about the redundancy. Ask yourself if you are addressing every single one of these components, at least in a 60% of capacity. Are you basically just focusing on gratitude and mindfulness? I know that the circumstances are very difficult at this point to be able to say, you know what, I'm grateful for what I have right now. Again, resiliency can be able to just help us to just move forward in life, but we need to take that break to reflect on what are we grateful for and to practice mindfulness on this whole process. The second question is my environment conducive for me to be able to address my own issues and also my family issues and the community as well? Remember, it starts within ourselves. The second question is, am I setting healthy boundaries for myself? Am I setting boundaries and basically for time management? Am I taking time to be able to take care of myself? Or am I investing my time to be able to take care of everyone else and basically just neglecting my own mental health, my physical health, my psychological health as well? Are you asking for help? Are you having difficulties to ask for help or other people? What about family and trusting others? Is basically reaching out to other people and say, you know what, today I'm struggling. I think that I have difficulties to basically just work on my finances. And, my children are driving me crazy at home. I need to basically stay the whole entire day. I don't have time to go out. I cannot be able to go out because I'm afraid that I can basically either be exposed to the whole COVID-19 and I don't want to go through that. And these are basically examples. Are we basically just addressing our religious views and spirituality? How are we doing that? How can we be able to make connections with the community in regards of developing a spiritual connections with others to be able to foster our own spiritual relationship as well? What about interests, hobbies, and playfulness? And I understand we're limited at this point because, the whole COVID-19 limit us to be able to just go out, but the weather is getting better. So that means that we can be able to do a lot of outdoor activities. We can be able to encourage communities to just do a lot of stuff outside, to be able to just find out ways that we can be able to go back to personal interests like arts, music, exercising. And that's our second component. Am I exercising well? Am I sleeping well? Am I having a good diet at this point? And these are very, very important components at this point in history, because as you can see, we have been isolating at home. Our eating patterns are not necessarily good ones because maybe we're compensating, trying to manage stress and anxiety with eating a different amount of foods, and also the social community. So I hope that this benefits you guys. The whole idea, again, is to be able to bring awareness, to be able to encourage you to start breaking the stigmatization, for you guys to understand that the mental health silent pandemic needs to be addressed as soon as possible in order for us to be able to start encouraging people to just get healthier, to be able to foster healing on this whole entire process in order for us not to be able to suffer the consequences in the long run. So thank you so much. I appreciate your assistance. Thank you so much, Eli.
Yeah, no, absolutely. Thank you for sharing with us. And again, we wanted to do this because this is something that folks are not paying attention to. And here, I'm going to specifically single out our public policy people and policymakers, so legislators and those that make laws and establish policies for our country, our states, and cities. We need to pay attention to this, provide proper resources so that communities can be given resources, right? And be and provide something that is not being given at this time. Marta, and we want to take out 20 minutes or so for any questions that you all may have and may want to pose. We'll entertain a few of those. But I want to start and just take advantage by singling out again why we had a couple of slides there focus on people of color, and I'll just say this as a footnote, but we have seen the statistics, and again, it may not be spoken of right at a level that it should be, mm-hmm. But we have seen that communities of color have been impacted most, not only in terms of being victims of COVID-19, mm-hmm. But it's more why they have been victims, and even not just of the virus, but also the mental health component. Mm-hmm. And there was a recent New York Times piece singling out the state of California and how Latinos specifically have been more prevalent to the impact of COVID, right? And the aftermath, because Latinos, mostly African Americans, have been on the front lines, right? Because of work responsibilities, work obligations. They were essential workers, right? Mm-hmm. And they had no choice but to continue to work, right? And we think about even a lot of civil service workers, right? And here I think of in New York, the Transit Workers Union and these transit workers that they never stopped, right? I think about the restaurant workers that although in dining services were canceled, but still they had to be out there, right? So that is why we wanted to single that out, because that leads to other pressures, the economic anxiety that this produces, right? Mm-hmm. So that I just wanted to point that out, but also point out the policy perspective. And I thought maybe we should have a follow-up and look at what could be the policy implications of all this, so that our elected officials can understand that there's something that they can do to help our communities and provide resources that are necessary. I don't know if you want to chime in on that part, but
yeah, I think that we should take in consideration as well the ripple effect of how our leadership can be able to just start working on targeting these particular issues. This is a multiracial situation. Yes, there were a lot of workers that just were 24 hours active. Our concern is basically what we call the social burnout. There are a lot of people that just reaching that point that I don't even want to work anymore. And they have been on the front lines for so long, and I basically experience it every single day. I have coworkers that just basically say, you know what, we're tired, and they have the passion to serve, but at the same time, it impacted all of us. And the ones that we were working frontline and we were just basically just reaching out to people, serving in so many different directions, we're just reaching to that point that if this is not addressed immediately, if we're going to be able to address a social burnout, then the consequences can be catastrophic to a point that it can be irreversible. So it's a concern, and I agree with you. I think that we should be able to bring it into a different dimension that can be just targeted in a way that is structured in stone, so people can be able to just do what they're supposed to do to address the mental health component.
And let me just quickly, and feel free to add, and then we'll get to any questions. So if you have any questions, just be very brief. We'll open the mic, and I see a couple of folks have already commented in the chat box. So we thank you for doing that. But I do want to point out this issue of I was going to say stigma, but let me just say this, because I think this is an issue, right? Mm-hmm. Which leads, I think that the cause of it is because of stigma. But what would you say as a mental health expert? What can you tell people, maybe, or reemphasize? How can we identify the effects of depression, or maybe even what triggers can be leading to that, right? Because I think a lot of people are not able to identify behaviors that they have, or you even mentioned the eating part, right? Mm-hmm. We all heard of the COVID pounds, right? And like you said, that's a way to compensate for other factors, right? So the thing is, how can people identify that there may be something happening mentally, right? Psychologically, that they may not even be aware of. So, how can you help us?
Definitely. That's a great question. We always encourage in therapy, whenever we're serving clients, to always practice self-assessment. Take a couple of minutes every day and say, okay, so what am I just thinking or feeling that I'm not willing to share with anyone else? And this is key. Whenever people tend to have either emotional or cognitive suppressions because they're concerned that people will either judgment or something should come out from it that is not necessarily positive or benefit. And also, I'm gonna be honest with you, and I'm guilty as charged. I suffer from something that is called the Wonder Woman syndrome. I have been told about it many, many times.
Do you have the shirt?
No. But someone gave me a cape, and I'm just like, I don't need this. So, the Wonder Woman syndrome and the Superman syndrome is basically that we believe that we can carry the world in our shoulders, and we don't need to talk about our issues. We don't need to basically address our issues, and therefore, it takes a toll in our psychological life. Not only that, because the ripple effect, it affects also our body. We start to basically have what we call the cognitive displays, or basically psychosomatic projections, we call that. Our body starts speaking for us. One of the main effects of holding stress basically is just having heart attacks or brain aneurysms. So we need to start making these personal assessments every single day. Okay, so what am I just holding that I'm not willing to talk about? Or am I trying to hold the world in my shoulders because I think I can do it all and I can be able to take care of everything because my family needs me, my job needs me? So if we start developing these assessments in regards, am I sleeping well? Am I eating well? How much coffee am I drinking? And let us be honest, we have a tendency to drink tons of coffee, but this is a way. There you go. Yeah, it's basically just giving you a self-disclosure, guys. So just saying. So,
guilty as charged.
Well, at least you acknowledge that this is an issue. I'm just kidding. So, with that being said, whenever we practice this self-assessments, it allows us to understand. Okay, so what are the things that I need to address in order for me to become healthier, to be able to create personal stability, and not only that, to be able to extend safety. And focusing on the ripple effect, whenever we're taking care of ourselves, it's natural that our families are going to become stable. And please don't misunderstand. We have tons of problems. We have issues. I get that. But it starts within ourselves first in order for us to be able to impact the collective.
So thank you, Marta. I'm wondering if anyone may have a question and I'll get to those that pose something in the chat box. But if there is someone that wants to ask a question, we have about 10 minutes left. I'll just ask you to be very, very brief. Please don't take longer than 10 seconds to pose the question, so that we can have ample time to get any more questions and for Marta to respond. So if you do want to pose a question, feel free to unmute yourself, and again, give yourself 10 seconds to pose the question.
We're just reading a couple of the questions on the side too.
Okay.
Yeah.
So let me just I'll go in order with the comments placed in the chat box. But Grant Valentine, that the position of mental health recognition runs across all community of colors. But there was another point he brought up. What are the number of cultural intelligent practitioners available in communities of color? I'm going to read into that question, but I'm assuming the question goes at is cultural sensitivity, right? Yeah. That's a critical question. So yes, it is. I'm wondering how you will respond, because frankly, there are very few, right, mental health experts that are people of color, right? Now that doesn't exclusively define the whole cultural sensitivity thing, right? But it's a critical question. So I'm wondering, as a Latina, what do you have to say about that?
Well, when I read the question specifically, I can decompartmentalize it in different types of sections. So my understanding is he's asking about cultural intelligent practitioners, and I'm very careful about that particular statement about cultural intelligence. What I can share with you specifically, Grant, is that we are mandated to be trained in cultural sensitivity. And in order for us to be able to serve the community, we are expected to be able to understand what cultural sensitivity is all about, including working on our own biases, to be able to work in our own judgments and understand that we need to serve the community as equal in equity as well. So with that being said, giving you specific numbers about intelligent practitioners that are cultural sensitive about it, I apologize, I don't have those numbers yet. What I can let you know is that we are mandated to be training cultural sensitivity in every single type of dimension. It doesn't matter the ethnicity, we need to basically just get educated and just acquire knowledge in every single community that we're gonna be focusing on, including the ethnicity component.
Tasha says she would love to have more conversation about vicarious trauma in a future webinar. So
definitely.
Thank you for sharing that. Let me also get to Jason Kamora. I think you know who he is.
Yes. Hi, Jason.
Is there, and Jason, this is a critical question, and I'm sure there are folks out there watching us that are in the mental health field or even in the social services field. So this is useful information, and feel free to take this back. We're going to go back to the slide that provides a text number. Yes. So if you know of someone that needs some type of intervention, we want you to have that information. But the question he poses is there some simple things people can do to reduce their stress? So if you can just quickly share one or two things.
Yeah, everything in moderation is recommended. Simple things that we can do in the morning, we can be able to practice mindfulness exercises. We can read books. Just take a couple of minutes in the morning before starting your whole day. Just read mindfulness, just develop exercises for mental health stability. You can just go out, just walk, just do exercises, physical activities. Sometimes, and guilty as charged, I love cleaning. So sometimes cleaning grounds me. I use it in a way that I can be able to just de-escalate my own stress And I don't basically just need to get crazy about the cleanliness, but it allows me to just get that sense of control and regulate myself. Also, eating habits is important, as we mentioned before. Just trying to be able to develop exercises that can create that balance in a holistic way, not only in a physical component, but also your soul and your spirit. It's a good question. Thank you. And Tasha, definitely, I would love to do a webinar in regards of the vicarious trauma, definitely. Well, if I'm allowed to.
Well, yeah, I think there are several follow-ups here. And again, we are grateful to the Latino Leadership Institute. Jaime Estades, who's the director, the founding director, we thank you for making this platform available to us to share this. Let me just say, so Jean Rieger, we know Jean very well. So it looks like she has a question. And again, we only have a couple of minutes left. So Jean, if you can be very quick with your question so we can make sure to respond to it.
Yes, I just wanted you to address another realm of this issue on a resource that many folks would go to if they had need of help or someone to talk to or whatever, would many times be their church. And the church and the community of faith is an important place, especially in communities of color. But the stigma of mental health and the paradox of if you have faith, you wouldn't be having issues with these things, makes it very difficult to go back to your church community and ask for help. Could you address that kind of dilemma that people might have, that they lose that resource, at least in their mind, and what the church can do to step into that place?
You want to start?
Well, I mean, it's a great question, and I think you were hinting at it with that chart, right? The self-care chart.
Mm-hmm.
That for many, not for all, right? But for many, religious communities, religious practices could be a mechanism that helps in many ways, right? And here I'm biased. I'm an ordained minister, so I'm biased, but I do see, right, the effectiveness in many ways, right, of religious communities. However, they can contribute to some of the stigmas, right, where certain beliefs can actually be detrimental for some in seeking out help, right? So, but that's another webinar. But let me, if you can just quickly respond to Jean's comment.
Jean, thank you so much for the question. You're right. And this is just my humble opinion. I believe that this spiritual community should be trained and educated to just increase the cultural sensitivity, to be able to extend safety and to be able to promote welfare, for the members to be able to just go back to their spiritual communities and say, you know what, I'm struggling with mental health issues and I need help. So this particular spiritual community can have the resources to say, you know what, so maybe we can give you numbers that we can just refer you to particular services so you can benefit. There are so many people within this spiritual communities that are willing to serve. So I believe that these resources can be, taken advantage and just develop these little cells within the spiritual community that is not conflictive with their own structure, and say, you know what, because this is part of human service, we can be able to develop this particular program, maybe a group setting that people can be able to open up and talk about any issues that they're going through in regards of the pandemic crisis, or basically mental health issues, financial issues. I can guarantee you, and as you know, Jean, because you have been part of a spiritual community yourself, there are a lot of resources that are willing to serve other people. And we should be taking advantage of that in order for us to be able to foster safety and extend welfare.
And I believe that religious communities, but not just that, right? Educational institutions, nonprofits that don't work in the mental health field. I think there needs to be an openness to receive these type of webinars or workshops so that so that they know what resources can be available, right? You said mental health affects everyone. So I think that folks that are embedded in different institutions, they should all be willing to learn, right?
Yes.
About how to identify issues, how to cope with issues, and just provide resources, not to make a mental health expert of everyone,
Of course.
but it's just to have enough information to know where to go. And in terms of where to go, there's another one. Are there any resources you recommend that we connect people to? I put again in that screen the 741-741. That's a crisis hotline kind of thing.
Yes. Yeah.
So just spread the word, right?
Yeah.
You can text that number. And
also, one of the ways that we can be able to encourage people to just find assistance besides the crisis line, which is a nation number, everyone has access to it. Please just I can be able to provide information as well. Also, people that have insurances, you can call your providers as well and say, you know what, I'm in need of community service such as mental health. There are a lot of people that they don't have the insurances. That doesn't mean that they don't have access to these particular services. Services cannot be denied to any individual in this nation. So please don't feel like, you know what, because I don't have insurance or I don't have the financial income. And I'm going to be honest with you, because of the stigmatization of mental health, there are a lot of people that think that because I don't have the financial income, I'm not going to be treated equally, or I'm not going to be served the way that I'm supposed to. And that's something that we need to start breaking. Everyone's deserve equal treatment in regards to mental health. Unfortunately, because of stigmatization and what the concept that we were talking about, internal stigmatization, I believe that I'm not going to be treated as well as someone else. That's something that we need to work on, but the resources are available for everyone. And if you guys need more information, please feel free to reach out. I'm more than willing to just provide several places within the Lehigh Valley. And also I know that there are people from different types of states, and we're very grateful for that. But we can do research about it and just create a document in order for people to have access to community service, mental health services as well, and other type of programs that they can benefit from, including financial, educational, and besides the ones that we mentioned before.
Mm-hmm. So again, we want to thank you all for being here. Marta, thank you for making yourself available to be a resource to all of us. Grant says he's going to be later on a criminal justice panel. One of the topics is on mental health and policing.
Oh, that's awesome.
So Grant, we hope that you just I'm sure you will hit a home run. I'm glad that topics like these are being discussed. They need to be discussed. Mm-hmm. So once again, thank you all. Thank you, Marta, and we thank AJ, who is with the Latino Leadership Institute, and we thank the Latino Leadership Institute for providing this platform. We will hope to continue to provide more webinars and continue to be a resource. So thank you all very much.
Thank you so much. Have a good day, everyone, and please be kind to yourselves.
Thank you so much.
Thank you.
And thank you to everybody else. Have a great day.
Thank you.
Thank you.